Good afternoon, everyone. My name is Sharinda Williams with the Georgia Health Information Technology Extension Center, located at Morehouse School of Medicine's National Center for Primary Care, where the future of health IT is here. Turn it on. We would love to connect with you on our website, GA-HITEC.org, or on our Twitter, at Georgia GA-HITEC, hashtag HIT Solutions. We welcome you to our webinar, MIPS Straight Talk Practice to Practice. And I will now turn this presentation over to Phoebe Nelms, our moderator, Program Manager for the Technical Outreach QPP at Georgia HITEC.
Thanks so much, Sharinda, and welcome everyone. I'm really glad that you could join us today because we have a new format and we're really excited to share the information we've prepared for you today. As you all know, Georgia HITEC is Georgia's only federal and state-endorsed expert to help practices all across the state to achieve meaningful use and also to participate in the Quality Payment Program MIPS track. And as Sharinda mentioned, we're located at Morehouse School of Medicine, and we are within the National Center for Primary Care. So just in the interest of this disclosure, in compliance with ACCME guidelines, the following speakers have no financial or other relationships with the manufacturer of any commercial services discussed in this educational activity. So our title for today, MIPS Straight Talk, Practice to Practice. And we have assembled a panel of people who are in the trenches doing the real work of making the MIPS program a reality for their practice. We have Liz Hansen, Elizabeth Howard, and Paige Stover, and they'll all tell you a little bit about themselves as we move forward in our presentation. So, to get the temperature or take the pulse of our audience, we just have 3 polling questions, and we thought we'd get these out of the way in the beginning. So the first question is, are you required to report to the Quality Payment Program MIPS track for 2018? So thank you all for putting your responses in the box. So you might notice that the last option was no, but I'll submit data anyway. And we'll talk about that just a little bit. So thank you so much. Most of you are, and some have selected option C. And of course, you can check your eligibility for the program by going on to qpp.cms.gov, entering your NPI, and you'll see your eligibility and all the tax ID numbers that your NPI is associated with. So moving on to our second polling question. Since you do have to participate, how do you plan to submit data for your quality reporting? Do you plan to use claims if you're an individual provider submitting data? That's the only way that one is an option for you. Or are you going to use a QRDA-3 that's generated from your electronic health record, use a certified registry, or a qualified clinical data registry? Wow, it seems to be 100% will use the electronic health record and generate a QRDA-3 report. And of course, we know that CMS gives these various options because they're trying to build flexibility into the program so that you have, and they incentivize you though to use the electronic methods by giving higher points for those. And we're now to polling question number 3. This is the hot topic. What is the greatest barrier to your participation? Is it understanding the requirements of the Quality Payment MIPS program or finding the time to invest in doing it successfully? Is it an issue with generating reports, or is there something else that has created a barrier for you or a challenge? And if you would be so kind as to type what that other challenge is in the chat box so we can get your feedback. So that's why we're really glad that you joined us today, because nobody said, oh, I have no barriers at all. So we're hoping that because you joined us today, you'll come away with at least one actionable item, one tip, one suggestion from the panel of practice managers who will share their experience in pulling all the pieces together to do MIPS reporting successfully. And so we'll go back to our presentation, and thank you all so very much for submitting your feedback and letting us know where you are in this process so that we can tailor our information to you. At this time, I'd like to turn the presentation over to Liz Hansen, who has successfully supported many, many practices, and she will introduce our guests and lead our panel discussion. So Liz, if you would be so kind to take it away.
Thank you, Phoebe. I always love being introduced by you. You make me so happy. So our goals for today's call is primarily is to have a different format so that we have some practice input and presentation around some of our issues. And so we're going to use that to identify strategies and share tips that support MIPS success. We'll talk about some of the challenges, and some of y'all are still putting those in the chat box, and we appreciate that. We'll talk about some solutions that we have, that some of our practices have established to meet these challenges. And we'll talk a little bit about the impact of participating in the MIPS program. And of course, joining us today is Elizabeth Howard, who is with the Morrow Family Medicine in Cumming, Georgia. So again, I want to remind you folks that we focus typically on small, underserved, and rural practices. And so although Cumming isn't rural, it's not downtown Atlanta either. So I think that Elizabeth experiences some of big city and small city. And then we also have Paige Stover, who is with Lawrenceville Family Practice. And again, Lawrence is outside of the main Atlanta area. So if you would perhaps, Paige, if you would start off and tell us a little bit about your role with Lawrenceville Family Practice, we'd appreciate it. All right, while we work on that, Elizabeth, perhaps you could start for us.
Yes, absolutely. Can you hear me?
We can.
Excellent. My name's Elizabeth Howard, and I'm the practice administrator for Morrow Family Medicine. I have been with our practice for almost 7 years now, and I handle all HR stuff. I handle all the MIPS, and I do also handle all of our billing. And we are a small practice. We only have 5 providers. And like what you had introduced us, we're about an hour north of Atlanta.
Very good. Thank you. Okay, Paige, have we got you there yet?
Can you hear me now?
Oh, you betcha. Okay, Paige, tell us a little bit about yourself.
Okay, well, I have been with Lawrenceville Family Practice for 8 years, and I've seen CMS growth and expansion through all of our quality payment programs dating back to the early beginning here. So we've had many hurdles and challenges that we've overcome, and I hope that in our panel session here we can all learn from each other's challenges that we've all experienced.
That's awesome. All of us, we're hoping that's what we will accomplish today, and maybe we'll learn some new challenges we need to find solutions for. So to start us off, Elizabeth, if you would, could you talk to us a little bit about some of the challenges you've seen with the programs?
Honestly, the biggest challenge that I had starting out was I had to actually learn the requirements. Embarrassingly enough, when we started this journey a year or so ago, I thought that only Medicare patients were involved. I didn't realize it was all payers. So honestly, when we started, I had a very hard time figuring out what my requirements were, even from the basic thing. Who am I supposed to run these reports on? What pool of people? Only this age? All of them? I struggled. I really did struggle learning what I needed to attest on, what I needed to run a report for, because it was just overwhelming how much data was out there and having to try to figure out how that incorporated in the everyday workings of family practice and what I needed to attest on. That was my biggest struggle to start out with.
Wow. And I'm thinking we actually had some folks that had commented on learning learning what was required and how to manage that was one of their biggest challenges. How about you, Paige? What are some of your biggest challenges?
I will echo off Elizabeth here in that it is challenging to take a deep dive into each individual measure and find out what LOINC code needs to be used, and it's so specific for each one. It's really taking a deep dive into each one and finding the time in our day to do this. It is challenging. And also in what Elizabeth was saying with, it's not just Medicare patients. I don't know if it's true for everyone's EMR, but we had to assign every single insurance that we have in our EMR a source of payment code. And a lot of times that's challenging in itself for those that are more clinical than on the insurance side of it. So there's many challenges for each of us to overcome.
So in working with, I think one of the things that both of y'all are making clear is that you committed the time to learn these things. Paige, you mentioned the LOINC code. I'll bet there's some folks back out there sitting there thinking, what in the world is a LOINC code? I know the first time I heard it, I thought it was a noise a pig made. So, time is an issue. So how do y'all manage the time?
You just kind of have to do a little bit here and a little bit there. I felt like when I first started, just trying to figure out what we were going to attest to and how to attest to it, like she said, with the LOINC codes and making sure we were meeting all the requirements to actually report to it. Because just because you say that you did it doesn't mean it's actually going to report that you did it. You just have to just kind of get lost in your EHR for a while. You have to put a ton of tickets in so that you understand how to report, if you're reporting correctly. And I felt like I kind of almost took it as when you're a new student and you're trying to learn, you have to kind of do a little bit every day. You have to carve out a little time every day to really go in there and just kind of get lost in running the reports, trying to figure out what you're doing, coming up with a method to your madness, because you can't do it all at one time. You can't do it just once a week. You have to constantly work on it, I think, almost every day.
And it is lucky that both of you ladies happen to like looking at your reports and analyzing your reports. I do think that is a challenge that some of our folks have. And part of this time drain isn't just that you have to learn yourself. It's also about teaching others. Paige, could you talk to us a little bit about that?
Yes, it is very challenging to get your providers on board and keep them on board. You have to constantly look at your numbers, run your reports, ensure that all of your buttons are being clicked by the providers, and making it a goal within the practice to achieve excellence.
Okay, so the goal of that is that you have to have clinician buy-in and everybody has to be on board. Would y'all agree with that?
Definitely.
Okay, and so one of the things that the questions that came in with registration was, how do you create this buy-in with providers? What are some of the things that we can do to create this buy-in for providers? So do y'all have some ideas about how did you create this buy-in, besides just having great providers, which y'all do, but how did you work on creating the buy-in?
You have to make it easier for them. We have quick text within our EMR, and at every office visit, like for a diabetic patient, it'll automatically populate their last eye exam, their last diabetic foot exam, their last A1C. So it can help prompt them to remind them, hey, just because they're here because they have a runny nose, we also need to look at their chronic care problems as well, and reiterate if they haven't had that eye exam, go ahead and put in that referral if it's not been put in this year, and encourage the patients to go ahead and get the exams that are due. For our depression screenings, we implemented that on our tablets that our patients complete their registration on. They complete their PHQs on there so that the provider has a chance to look at that before they're going in there. It's helping them to remember to do everything, because it's challenging for the providers as well when they have that patient in front of them to remember every single thing that we need them to do.
And some of them don't like anyone to know they don't know something. So sometimes it's hard for them. Sometimes I'm glad everybody's on mute. That might have gotten a laugh. Sometimes we need to provide them with an easy out, or with a cheat sheet, if you will, on what the workflow's got to be. Any ideas from you, Elizabeth, on how you got physician buy-in? Although I know that your main physician is one of the champions. So any ideas on that?
Well, we definitely had our nursing staff help assist our providers in helping them on the like Paige said, it's really hard to remember everything you're supposed to do. So we did kind of the same thing, mirroring them. We had short lists. We would talk about it once a month on what we needed to do and what was required, and how can I make your life easier? What's so hard about the short list? Okay, we don't like this, we don't like that. So we really went in and changed things around to make it very simple. And then we did a lot of the same stuff for, everyone got it. So it's just kind of no matter what patient you were, we just started putting it in our everyday repertoire, of doing the same thing over and over again. And I think, at first it looks too challenging, you don't want to do it, but they get better at it. You just got to have your nurses on board and stay super positive. And then also, honestly, financially, it is beneficial to them to do this. Not that it's all about financing, but it helps with all of the payers, not just Medicare, if you start doing this for all your payers.
Well, I'm glad you brought that up, because since one of our questions that came in was about creating buy-in, I thought we might just go through some of those pieces that they might use specifically. And one of those is the dollar impact. And we are going to talk about impact, but if your providers are being hesitant or too conservative and don't want to get into working on this program or hesitating on you, then it might be interesting for you to run the figures and see what the financial impact would be if they didn't participate. And don't just do it for this year as the example. Go ahead and project it out, when the percentage is 5% or 7%, or when that percentage goes up. Let them see what the impact might be of them not participating in the program. And although we know patient care is critical, that might get them thinking about it. Another thing that you might want to talk to your providers about is how this sets them up in the marketplace. Because maybe not this year, maybe not next year, but within 2 or 3 years, patients are going to make decisions about what providers they want to go to and whether they have technology, be it with the portal, be it with their websites, be it with the way they interface with the patient, with secure messaging or exchange between providers. This is going to be something patients are going to begin to demand. So even if they say we're too old and we're going to retire, well, they probably want to sell their practice, and a practice that's participating in a program and set up to succeed is going to sell better. So again, we want to make sure that they're aware of what that impact could be. Also, you might ask each one of them to own one of the measures. Maybe make someone the champion for A1C. Make a little competition between the providers. Perhaps share their scores with them weekly together so they can see how each other are doing. So those are just some of the ideas. You folks may have some others when we continue on with solutions we'll talk about. But I want to circle back to something that was mentioned earlier about using the EHR and working with your EHR. Both of you ladies have mentioned specific things within the EHR that you had done. So, Paige, would you talk us a little bit about utilizing the relationship with your EHR and making sure you're maximizing your EHR knowledge?
Yes, I will echo again off of Elizabeth. When you've got to put in tickets, you've got to ask specific questions, watch your clinical reporting program and see, okay, well, you look at it and you're like, I know we're doing these hemoglobin A1Cs. Why are they not counting on our score? And it's taken a deep dive in with your EHR to find out exactly, have them shadow you and look on the backside to see what LOINC codes are assigned or what observation terms are used, and there might be just one that you're missing, that you're doing it. It's just not assigned correctly. So it's really leaning on them to do their job and help you to make sure each single measure is you're getting the credit for the work that you're doing.
And establishing a relationship with the EHRs is sometimes difficult for us to do. Elizabeth, how about you? Do you have to communicate with your vendor a great deal, figuring things out?
Yes, I felt like the vendor knew my name every time. The same person kept calling me over and over, and we definitely kind of had a relationship. You definitely have to not be afraid to put tickets in, and not to be afraid to put tickets in on something that you feel like is just minuscule, because as Paige said, you know you're doing it, and you just don't know why it's not reporting. Or, you know, I had to go in and, you know, I'd take a particular measure, then I would go into my EHR vendor, pull it up on how to report on that measure, and half the time I didn't know what it meant, because let's face it, what did that 10-page article I just read mean? And so then I'd have to put a ticket in and say, I don't know what it's telling me to do, but if you can show me one time, I'm pretty savvy, I can figure that out. And so it's just really not being afraid to put tickets in, and not being afraid to go in and alter a few things in your EHR. I felt like at first, when I first would go in there, I definitely got scared. Ooh, can I do this? You know, but then you would do it, and then you'd run your report, and it was kind of like satisfying. Yay, I got I'm getting the numbers. It's working, and not being afraid to go in there and make those changes in your EHR so that you can report and get the numbers you want.
It almost sounds, Elizabeth, like both of y'all are saying that the squeaky wheel method might be the best when it comes to working with your EHR. And I tell a lot of folks there when they say, well, they didn't call us back, they didn't answer, and I just say, go at them again. Because there are many questions, even though Phoebe and I assist you folks in your practices, there are, 700 EHRs. And we don't know the intricacies of your EHRs, and so we have to work with your vendors to resolve some of the issues. But I know that is a great challenge, and there are many other EHR challenges that we could probably spend time on but not necessarily resolve. Now, both of y'all have mentioned that you need to be diligent, but you have two different methods, I think, of how you're handling your weekly diligence. But Elizabeth, you felt pretty strongly that you needed to stay diligent daily. Is that correct?
I did, especially when we were first implementing everything. I definitely wanted to see if my numbers were changing, knowing that, if I did that every day, because what I didn't want to happen was a certain amount of time go by and we missed this window of not being able to report, because we had some issues. I think maybe later we'll talk about them, but we were doing like the depression screening, and we were doing everything we were supposed to, and it wasn't reporting. And so there's a time period when I was doing it every day, trying to figure out why my numbers are not changing, and then being that squeaky wheel to my EHR going, what is wrong? Something's wrong, and then learning that also that you can't panic too soon, because it does take a certain amount of time for the data to flow over from your EHR to start kind of reporting. So
that's true. The thin line between squeaky wheel and crying wolf. Mm-hmm. Now, Paige, you use a little bit of a different method, right? But you still feel like you need to do the weekly diligence, but you usually do pick a time period every week or a day. Is that correct?
I do, and fortunately, our clinical quality reporting program, under each measure, it will tell me what patients met the measure and what patients did not meet the measure. So then I'm able to go into the not met category and actually look at the patient's chart, make sure that he did do what he was supposed to do, or did he not do it. And so then I go to him and I say, well, why didn't you do the referral for the eye exam, or why didn't you do the hemoglobin A1C for this patient? So they know that I hold them accountable, because I can see who they've done it for specifically and who they have not.
Excellent. Now that's a good way of using the data, and I know that both of y'all are committed to using the data. And What about being a small practice? Do you feel like that creates any challenges in and of itself, Elizabeth?
You know, I do, because for us, and part of our buy-in for the providers, is we are a small practice and we have an issue. You know, we can't really negotiate fee schedules. I mean, they kind of laugh at you if you try to negotiate and send them their strongly worded letter. You know, try to get some sort of fee schedule increase. We just struggle with that because we don't have a footprint, you know, a strong hold, because we are a small practice. And so even though it may be just a couple of percent, it's huge for us. And so that was part of the buy-in of, you know, this is a way to increase our fee schedules. And it's a way, honestly, to increase your fee schedules maybe with some other practices, because you can get bonuses. Maybe if you want to do it for like everyone, we were talking earlier that just because, hold on. So if we do this for everybody and then this payer audits us, and there's certain things we've got to meet for Advantage plans, you know, we're doing the data all across the board, and then before you know it, you realize that you're getting bonuses from other payers, not just Medicare, getting the couple percentage points. You're getting your bonuses all across the board, and it really does affect us as a family practice who is small, north of Cumming, to have that 2 or 3% makes a huge difference for us, and it has that buy-in for providers.
Wow, Elizabeth, I think you just gave us one of our impacts or benefits, because it sounds like the efforts that you took, probably beginning with Meaningful Use and then with MIPS, actually impacted the revenue that you were bringing in with other payers. Is that right?
Yeah, absolutely. Yeah, because we would get quality bonuses in the mail, and people were like, great job. And I'm like, it's really not a great job for me. It's a great job for my providers and my staff, because they're just doing what they're supposed to be doing it, and they're doing it for everybody. And just by meeting these measures for everyone, you know, it's helping us with other payers.
Wow, that's great. And Paige, I know that your practice, I think you have, is it 3 providers? Is that correct?
6.
6. I missed the nurse practitioners and such. But in your situation with a small provider practice, it seems like y'all really work to maximize job roles. Talk to us a little bit, if you could. Did you feel that you had some specific challenges because you were a smaller practice?
Yes, and in numbers, you know, in volume. You can't afford to miss that opportunity. Every single person counts. Every single patient that walks in that door counts. So you have to seize the opportunity while you're face-to-face with that patient and ensure that all of the measures are met. And like Elizabeth said, it's not just Medicare. It's, you know, we all have the different insurance companies that we have quality star ratings. We have to make sure all of our HITEC measures are met, and a lot of the HITEC measures fall in line with MIPS.
So I'm really loving what y'all are saying about using this program, and the practice transformations that y'all are going through are improving and impacting so many different areas. But we'll come back to that in just a minute. Let's talk a little bit more about some other solutions that we've been finding. And one of the things that both of you mentioned were accessing resources or utilizing resources. I might have come into the conversation a little. So Elizabeth, would you address that, accessing resources or using resources to learn?
Well, I felt like GA-HITEC and yourself were great for us personally, and for me personally, because I do feel like I had some sort of a grasp on everything that I needed to do last year. But you really kind of came in and helped me, I feel like, take it to the next level, to really kind of pigeonhole what I wanted to do and make sure I was on the right track. Because for me, you know, you read all this data, you think you're doing it right, you're running reports, but I still had this secret panic of, I feel like I don't know what I'm doing. You know, I think that I'm doing everything right, but I'm not sure if I'm doing everything right. And it's just nice to have someone kind of help you out and look over your shoulder and go, yes, that is actually, you are doing it right. Because everyone has that secret fear that it comes reporting time, you run all your reports, you upload the data, and you were totally off the mark. You didn't do it correctly, you know, because it affects you as an administrator, you're in charge of it, but it affects the whole practice. And so I felt like you personally gave that to me to help me feel like I could do this for my practice, and I was on the right way,
And what a great job you did. And Paige, I know you like your research. Elizabeth does as well. But you did use the QPP site a good bit, didn't you?
I did, Liz, and it is a helpful resource, and it defines the measures. It helps you understand them, and it's always readily available. When you have your side by side, you can have your clinical quality reporting program up on one side and the QPP website up on the other, and compare to ensure that you're doing what you're supposed to be doing. But like Elizabeth said, if it wasn't for you to give me the reassurance that we're doing the right things and we're doing a good job, because I'd be like, okay, our score was only 97%, and you'd be like, that's a good job. And I'm like, is it really? Because I strive for 100, and is 97 good enough? I feel like we could have made that extra 3%. So having your reassurance, has always been amazing, and I couldn't do it without you.
Well, isn't that sweet? If I was a blushing person, I'd be blushing. Thank you, ladies, but we just want to make sure that everybody on this call knows that if you're in Georgia, we'll help you out, and we'd love to do it. These resources are for all of you and are provided through the federal government through our relationship with Alliant Quality. So please, if you haven't used our resources, use us and use the QPP site. Now, one of the solutions that y'all had mentioned, and I think we've kind of talked about this a good bit, is that you felt like you had to focus on MIPS. Did you do it just you focus, or did you try to get some other folks to back you up? Elizabeth, talk to us a little bit about this focus that you had on MIPS.
Well, it's not just me. I had a clinical coordinator. I had to talk about what Paige said as well, a provider that was kind of in charge. I had other staff that were in charge that could kind of help me out to focus on what quality measures worked for, or what measures worked for our practice the best, because that's the first thing, is sifting through and figuring out what works the best, and then having people to help you implement them, kind of like Paige said, holding people accountable for certain aspects of whatever you're trying to accomplish with your report, or whatever you've decided to do as far as your screenings go. And I feel like it has to be a group effort. It can't just be one person. If everybody's not on board and everybody's not, I feel like everyone kind of got obsessed over all of the criteria in my office, but in a positive way, making sure that everyone really wanted to make sure it worked. That's kind of how we did it.
Very good. And Paige, did you have anything you wanted to add to that?
Only that I agree with you. Have to find out which measure works best for your practice, but then once you find out which measures work best, expand that and then start looking at all the measures, and don't necessarily let the providers know that, hey, we're only going to submit for a handful of measures, but actually making them do all the measures and getting numbers for all the measures, and it helps your practice to evolve and being better every day at what we do.
Yeah, I agree on that, because we definitely went above and beyond on our measures. I didn't tell them you can only go for so many. I told them it was like 12. They had no idea. So 10 or 12. So they were in there trying to make it all work. It was a great strategy for us as well.
Yep, got to manage those clinicians. And I think, Elizabeth, you used what you call the short list, right?
Correct, yeah. So I ended up having a whiteboard in my office where I became obsessed, where I had all of what the measures that we were going to go for. And then we did a short list, and it was, if they went down this short list, everything would work perfectly. I'd be able to report for everything. I went in and spent tons of time that goes back to a time drain of how it can be so draining for the practice. But myself and a physician would sit down and what's the best way to make this short list, because even though it may take an hour or two to create your short list in the beginning, it really will pay off when the providers realize how easy it is to actually, if you just go into whatever short list we've created, meet all those requirements, click everything, hopefully nobody's counting clicks at this point, then we've attested, we've done what we're supposed to do. We've met the requirement for that patient. So
very good. Now, both of you I know are big on using your reports. Paige, could you talk to us a little bit about how you use your reports? Maybe you might have used your feedback reports to see how you did last year, and now you're constantly, I know you're always looking at your reports. I love to look at them with you. Tell me how you use that and what that means to you.
It helps me to know that we're still doing what we're supposed to be doing, that we've not let our guard down, and it helps me to let the providers know you're doing a great job. I appreciate the effort that you're doing because you're making us all look good. And then, I'm very interested to see how the portion is going to work out about the cost measure. I'm wondering how that's going to play in. I think it's going to be interesting to see, and also to see how our ER utilization is affecting that.
Very good. And you might be going off somewhere most folks haven't really gone into yet, but there is a feedback report on the QPP site when you log in, when you sign in, where you can go in and look. Most folks just looked at their scores and maybe didn't realize that they could scroll down and look at what their cost score was for 2017, even though it didn't count towards your adjustment. But it does count for 2018, and knowing what your cost score was 2017 might tell you whether you need to do some work on that. And of course, we've had a couple of sessions on that already, but if you want to talk about your cost component individually, and we'll probably circle back to that in the near future with one of our sessions. But the reports can tell you where you are and help you decide how to get where you need to go. And I love this next this is actually a quote, I think, from one of you: to make reports work for you and your patients, don't work for your reports. So I know it's painful the first time you try to run these reports, or it could be, but and if you don't do it again for another month, it'll be painful the second time, and the next month it'll be painful again. So I strongly urge you folks to be able to pull these reports up and look at them so you can quickly see where you are, and it's not a burden so much as it is a pleasure to see that you're making progress. Now, with plan of care, I think this is something, Paige, that you saw as a solution, and I think this may be somewhat similar to the checklist in that it keeps your providers or your clinicians on track. Could you talk to us a little bit about that?
Yes, it goes back to the quick text that I mentioned in the beginning, in that when the office visit document is initiated, if the patient's there for a diabetic follow-up, it will populate when the last eye exam was, the foot exam, A1C. If it's a female, it'll tell you when their last colonoscopy was, or their mammogram, or the bone density, and it just helps prompt the physicians on their plan of care and what needs to be done while the patient's in the office face-to-face. Another thing that we initiated in our plan of care is we purchased a hemoglobin A1C machine for the office, and we get the results in 3 minutes, and it really has cut down on the amount of time and hours that our employees have had to spend on the backside, because we have those A1C results face-to-face with the patient in the office. And we all know as clinicians, they'll say, yes, I've been on a diet, yes, I've been taking my medication, but if your hemoglobin A1C comes back with a 9%, well, you've not been taking your medication and you've not been doing your diet. So it gives that opportunity for the provider to have that face-to-face with the patient. If the medications need to be adjusted, they can do that while they're in the office, and it doesn't have to be done tomorrow when the results come in. So it's really maximizing your plan of care while the patient's in the office to help with time reduction.
And is this similar, Elizabeth, to your short list? Is your short list a similar tool?
It is. Yeah, it's definitely similar. We do. I was just thinking that Paige and I have done very much the same thing. We've also got the A1C machine in our office to kind of close those gaps, to have that resource available within 3 minutes to change the medications. And then as far as the plan of care go, we have something very similar to that, just as reminders and certain things that are in the charts that, you know, patient needs this, patient needs that. We take the time to go in and put that in everybody's chart, and it just definitely does help with patient care, because at the end of the day, it's, you know, it's about money, it's about reports, it's about everything else, but it really is about patient care and making sure that we're giving them the best quality care that we can give them, at the same time that we're trying to click all these buttons. We definitely want to make sure that we're giving patients good quality care, and it really is, all these measures are painful, but they do kind of allow you to give good quality care. Like, have you got your eye exam? Have you had your foot exam? Just like she was saying, have you had your mammogram? It kind of forces you to have that discussion that we hope that all the providers are actually having with the patient, but now they kind of have to. So.
And as y'all work towards the short list, the plan of cares, these checklists, if you will, make it easier for the provider and improve the quality of care. Did you find you had to change some workflows as you executed? Y'all are really going through practice transformation. Did you find, Paige, that you had to change some workflows?
Yes, we definitely did. And one thing about our EMR that's very helpful is we have a pop-up box that our users can see, and within this box you can put anything you want, free text, and I will say, you know, this insurance company sent us a letter that says this patient's overdue for an eye exam. Please address at the next office visit. And you have to read it. You have to click out of it. Like, it's just not a box that appears and goes away. They physically have to click it. So I know that they've had to have read it. And if I go back and run the report next week and find out that they didn't address the eye exam, then of course I'm going to go to the provider and say, why didn't you do it? So they probably get tired of seeing me come at them. That might be another reason why they do so well, is so they don't have to see me coming for them.
And Elizabeth, you changed some workflows as well, is that correct?
Yeah, we had to definitely change the workflow. Our nurses took on a little bit more of a load, just to kind of take the load off of our providers on some aspects, because what you don't want to do is have the patient come in the office and see them and you're staring at the screen 45% of the time, or 75% of the time of the visit, trying to make sure that you've clicked all your boxes. And we struggle with that, making sure that we give the patient enough time, and we're not obsessed with making sure all the boxes are clicked, but we're actually making eye contact with them, paying attention to what they're having to say. So our workflow, we had to kind of take a little bit off the provider, because we just don't want our patients to have that feeling, and our providers don't like that feeling either, that they have to stare at the computer, obsessing over whether or not they've done everything they're supposed to do. So it's a struggle. It's always an ongoing process. I feel like we're always improving our process, trying to figure out how to make it work for everybody.
And you keep in mind, I think you always keep in mind that this is to the benefit of the patients, and that 2% is important to the small practices, right?
It
4% is important. All the numbers are important to us, and you have to keep that in mind. Now let's, if we can, move to the impact. And okay, I have to tell you, Phoebe wasn't wild about my train wreck for impact, and that is not to imply that our program or our practices are a train wreck. It was just to show impact. But we do want to talk a little bit, if we can, about where you've seen the impact and how this has brought some benefit to your practice. Elizabeth, if you would talk a little bit about how this has impacted your practice positively.
Well, positively, I feel like we're closing gaps. We are the impact as far as taking better care of our patients, and I don't want it to sound like we weren't taking good care of our patients, but we are paying more attention now to our mammograms, our colonoscopies, all of the impact stuff. So I feel like we're taking better care of our patients, because we're really, instead of when they come in for a cough, because it's hard, because some of these patients we don't see a lot. You know, some people we see all the time, and then some people we might only see you once a year. And so, and that might be that one time when you come in because you have strep throat because your kid gave it to you, or have a cough or something like that. And being able to, when they're in there, making sure that it's not just a sick visit, but maybe it is, maybe we're going a little above and beyond for just that cough, but it is about patient care. We might actually find some stuff because we're trying to think outside the box, and we're trying to take you know, better care of our patients and meeting requirements at the same time. And then monetarily, as Paige said, you know, earlier, because of the HITEC and all the different things, they definitely mirror each other. And so I just felt like attesting, for, or not attesting, but for the HITEC, we really kind of blew that out of the park, because the data was already there. The struggle was not as hard making sure we had mammograms, colonoscopies, A1Cs, eye exams, all the stuff that family practice has to have, because we've already done it. And it was so much, it was great not having to call someone and beg them to get their eye exam, because we'd already addressed it at their last office visit. So.
And do you feel better prepared for next year because of what you've learned in the last 2 years?
I do feel better prepared. You know, secretly I kind of still scream on the inside when we talk about it, because I have this fear of what have I missed. But I definitely feel that we're on top of things, and we're going in the right direction. And, you know, I'm blessed because I have great providers that, you know, they're on board, and that makes a difference, to kind of have that team mentality. So.
Gotcha. How about you, Paige? How about some impact within your practice? Have you seen some?
Yes, Liz, I feel like it's made us a better team, because in our workflow changes, our medical assistants are now also looking to see when the patient's last mammogram, colon, bone density scan, things of those natures, when their last one was done. And within our quick text, the medical assistants are now able to go ahead and let that provider know when they open the document that you need to order a mammogram referral, just to help them in time reduction with the things that might not be why the patient's there for the day, but it helps us to capture it while they're in the moment. And also, like for the upcoming flu vaccines, we're almost there, and pneumonia vaccines, the medical assistants are also helping the providers to look at that before the provider goes in there to see if that needs to be done while the patient's in the office. So I feel like it's made us a better team.
Excellent. Wow, that's great. Okay, so as we begin to wrap up, the big question is, I know some folks out there are thinking, gosh, you guys scored in the high 90s. You might have had some hundreds out there, actually, between the two of you. How did you do it? So, Paige, could you give us some of your tips, your biggest tips on how did you do it?
Don't ever let your guard down. Just because your numbers were great last week doesn't mean they're going to be great this week. Never lose touch of your reports. Always stay on top of every single thing every week.
Agreed.
Okay. Well, I was going to say, Elizabeth, how about you? How did you do it?
I think you should also choose measures that are attainable for your practice. Sometimes don't do them just because they're easy, or don't do them, you know, make sure it works for you and your practice, because if you give them some measure that they don't understand, that we don't really do, it's never going to be met. People are going to have opposition about it, and you just really need to make sure you've chosen the right measures that are easily attainable, because you see it all the time, or you treat it all the time. You have to be smart, I think, when you sit down and come up with a plan of what your measures are that you want to go for.
And these are actually some comments that you folks had made that we put on the screen. To stay positive, I'll often tell folks you got to be positive, patient, and persistent. Accept it and get to work. Now, sometimes when y'all get on the phone with me, I'll give you about a 3-minute time to spew, and then we got to get to work. Learn and teach, so build the team. That's how you did it. And remember that technology is not a tool. It's not the enemy, nor can it resolve every issue. Sometimes we have to figure it out. Be solution-oriented. Don't focus on the problem. Focus on the solution. And this is a direct quote from these ladies. We got into medicine to help people. So we keep that as our focus every day. One last tip, Paige. Do you have one last tip for the folks with us on the webinar today?
Just don't be discouraged. Just because, you know, your score might not have been as what you wanted it last year, we still have many months in this year to improve your measures. Don't be discouraged. Always reach out to you for support and any helpful tips that can help them get through a measure that they're not meeting.
Elizabeth, how about you? Any last words of wisdom?
You know, pretty much the same. Just keep your head up, you know, just stay positive, and it's going to be okay. You know, you can change your numbers in the matter of 4 weeks or 6 weeks. So don't be discouraged. Get out there and don't be afraid to change something. Don't be afraid to add certain things. And I feel like don't be afraid to ask your providers or your staff to do certain things, because it's where everything's trending, and it's better to be in front of it than lagging behind. So go ahead and make those changes.
Absolutely. You can do it. Wow, that's been great. Now, we do have a few questions in the box, so I'm going to hand this back to Phoebe, because I know I'm pushing the time.
Thank you so much. I can't tell you how much I enjoyed that. That was just wonderful. Thank you, ladies. So, getting to the questions, someone wants to know, what is the source of payment code that you were referring to earlier in the presentation?
That was from Paige.
So within EMR, each insurance carrier has to have a source of payment code assigned to it to be able to report correctly on your QRDA. So it is like commercial, Medicare, TRICARE, there's like, I'd say probably 50 to 75 different types of SOAP codes that each insurance carrier has to be assigned to.
Okay.
All righty. So we have to know how that relates to making everything connect when you run those reports. So that's a really great tip.
So, Phoebe, I would just encourage them to reach out to their vendor, their EHR vendor, and have them help them apply those SOAP codes.
Okay, great, wonderful. And they call them SOAP codes? Alrighty, so next question. This is an interesting question. Well, let's go to this one first. Can you go further in explaining the shortlist concept? I think you did expand on it. So can you give us an example of maybe a few things that are on a shortlist?
Yeah, this is Elizabeth. So in our EHR, we have a short list. So in this short list, let's say someone's coming in for a physical, a complete physical, or you can't call it that if it's Medicare, but whatever they're coming in for their annual wellness visit. And so in that visit, it's going to have things like mammogram. So it's going to order a mammogram, and then colonoscopy to order a like that you would bring down. It's going to have all the other depression screening, fall risk screening. It's going to have everything that whatever your measures are going to be in that short list. So if somebody goes under, welcome to Medicare visit or annual wellness visit, and under this visit, it's going to have 10 things. If you click on all 10 things and actually address them in that visit, then boom, you've done it. You don't have to search everywhere through diagnosis and, other things to try to remember. It's just right there. You just one click and it'll all populate down.
And it may not be called a short list.
Correct.
This lives in every system. It sounds like it's the equivalent of what Paige's system has in the plan of care. So it may be called something different, but you typically have to set these up and customize them for the practice. And it sounds like it's well worth the time.
It was well worth the time, but it does take a long time to set up, but it's absolutely worth it.
And sounds like you coordinated with a clinician to make sure that all the most important things to them were also in that list.
Yeah, absolutely. Because then, as just a practice administrator, you don't know what you want to make sure you're using the correct diagnosis codes and making sure it's relevant.
Awesome. Our other question is, And thank you so very much for those answers. Is it legal for our EHR vendor to charge extra to answer MIPS-related questions in the workflow for the EHR?
If I may, Phoebe, this is Liz. Perhaps I should address that. And the answer is yeah, probably. If you have a maintenance contract and your maintenance contract includes calling for support questions around MIPS, then it should be included at no additional charge. But if you don't have a contract that specifies they're going to cover all questions or specifically MIPS questions, then yeah, they can charge you for it. So it would depend, I believe, on your contract. Do you ladies have anything to add to that?
It's Elizabeth. Our vendor, offered would you like for us to help you with MIPS? If so, it'll be X amount of dollars to sign up. And I'm always kind of pro that, especially for our vendor, because they help you with reporting, because you can run the reports all day, but transmitting them out like they're supposed to, and a world of other issues that you can have, because just because you have the data, you got to get your data from A to B. And so I definitely signed up for that program for my vendor, and so I didn't have to pay for any additional questions I had, because I'd technically already paid for it. But I do think that it's well worth the money investment.
And I think, Paige, you did as well, correct?
We did. It's usually X amount of dollars per provider, but honestly, you get your questions answered faster, and also, they know more about the EHR than you do, and they're able to get to the bottom of it. They can look on the back side and see why it wasn't met, what was missing, faster and more efficient than you can, so that leaves you time to focus on something different.
Great.
Wonderful. Thank you so much.
Oh, go ahead, Phoebe. I was just going to say, if y'all have more questions, we're kind of running out of time here. We've got to have the announcements, but email us, ask us your question, bring them to us, and we'll get you some answers.
And we've left the contact information up for a while, so hopefully everyone has snagged that and captured it. We welcome your questions, and we'd love to reach out to help you in any way that we can. Funded by CMS through Alliant Quality. So GA-HITEC's next webinar will take place on Tuesday, September the 18th, and we'll be talking about interoperability, promoting EHR optimization. This was a great segue into that. And so we'll be collaborating with the North Carolina Area Health Education Center, who are also QPP CERS coaches, and they do this work in North Carolina. So we hope you'll join us for that as well. And we have our virtual office hours, strictly devoted to QPP MIPS. Usually it's the second Tuesday. We've had to make some schedule changes due to work-related travel, and so we will be holding that on Tuesday, September the 25th from 12 to 1. MIPS, promoting interoperability, covering all the bases, getting everyone ready for reporting for 2018, as the year just seems to be flying by. And these monthly sessions consist of a presentation, and we also leave an opportunity for you to ask questions, and hopefully we have the answers to those questions. So please join us for future educational events. We're so very glad that you joined us today. And when you register for our events, you also have the opportunity to submit your questions there for us to look them up, do some research, and have resources available for you. So please join us for future events. This brings our presentation to an end, and again, thank you all so very much for joining us, and enjoy the rest of this beautiful day in Georgia.